Hello and welcome to this YouTube series, Reverse Type 2 Diabetes. If this is the first time you're meeting, my name is Michelle. I'm a nurse, health coach, and a personal trainer, and I'm here to help you reverse your type 2 diabetes, get off medication, have a normal A1C, and the best part, be free from all the complications related to type 2 diabetes. Now, every month we're going to have a different category, and every week we're going to have a topic related to that category. Today I want to go over some key factors in your labs, and I want to explain why it's very important for you to make sure you're monitoring these lab results. Okay, let's get started. And just remember that these numbers are not the numbers you see in your doctor's office. These are the numbers I use in my practice. And my hope is that this information will empower you to check your own labs and be on top of your own results. This is just for educational purposes only, so I'm not trying to diagnose anyone. On that note, let's get started. These are the tasks we're going over today. And just remember that one of the underlying causes of type 2 diabetes is insulin resistance. As a matter of fact, insulin resistance happens many years prior someone is diagnosed with type 2 diabetes. Now, insulin resistance is a condition where your body no longer responds to insulin as well as it should. And your lab results may look just fine, but oftentimes patients experience energy fluctuation throughout the day. They have this excess fat tissue and the mixed section that just doesn't go away. And they also may experience post-meal carb comas. Unfortunately, you're not going to get a test for insulin resistance in your doctor's office. Unfortunately, even if you ask your doctor, they're not going to do it. It's not something is regularly done. But in order to know that you're not in any risk, I want you to pay extra attention to these labs. Okay, so let's start with your fasted blood sugar or blood glucose level. A lot of times you see the normal is between 70 to 100, but if your blood sugar is anywhere in between 90 to 100, this is your red flag. This is the alarm for you to make some changes right away. Pre-diabetes is anywhere between 100 to 125, and diabetic range is over 126. Now, hemoglobin A1C, or you might see it on your lab as HbA1c, this is a simple blood test that routinely done in a doctor's office, and it measures your average blood sugar level over a 3-month period. Now, I want you to pay extra attention to this test. A normal A1C is between 4 to 5.6%. Pre-diabetes is anywhere between 5.7 to 6.4, and diabetes is 6.5 and above. You need to pay attention to this test. I had many clients that the A1C was between 7 to 8% range, and they thought everything was fine. They never received a call from the doctor. So you should be on top of this yourself and make sure you're in a normal range. Remember that high blood sugar is one of the symptoms of type 2 diabetes, and chronic elevated blood sugar is related to many complications. Unlike any other disease, type 2 diabetes affects every single organ in your body. So do not ignore elevated blood sugar. Another important labs that I really pay attention to when it comes to my clients is the lipid panel. I pay attention to HDL, which is also known as good cholesterol, triglycerides, and also the ratio of triglyceride to HDL. And we're going to go over why this is important. But in your doctor's office, you're probably going to see that normal is over 40. But for optimal health, your goal should be a number over 60. For a triglyceride, again, you see a normal value is below 140, but for your goal should be below 90. Now, why is this ratio so important? And as you can see, there's no LDL here. A lot of times when patients start on a low carb diet, we see an increase in LDL. So that should probably will alarm your doctor. But remember that LDL particle matters. Unfortunately, they do not do a test regarding LDL particles. We had this problem with my husband. We have Kaiser, and his LDL was high, and the doctor wanted to put him on a statin. We asked for a LDL particle test, but they say they don't do it at Kaiser, so we had to do this out of pocket. Imagine if you're standing on a bridge and below is a river, and then on your left hand you're holding a beach ball, but the right hand you're holding a golf ball. And pattern A is the beach ball, and pattern B is the golf ball. If you drop these two balls, you see that the beach ball kind of float along with the in the river, but the pattern B, which is the golf ball, when you drop it, it kind of stays and sticks, and that's what happens in your blood vessels as well. And one of the best way to know is just finding out what the ratio is. A normal ratio, if you have a anywhere closer to 1 or below 1, that's good. That means you're okay. As it gets closer to 2 or above, that means your LDL is mostly particle B. Another easy test that you can do at home and is related to many metabolic abnormalities is checking your waist circumference. This is one of the measurements I want them to keep track of because we don't go by the number on the scale. We go by waist circumference, and which is a more superior predictor of type 2 diabetes. Your waist circumference should be less than half of your height. And remember, as your central obesity increases, the risk for cardiac disease and progression to type 2 diabetes increases as well. Now we're going to do a video regarding blood pressure and how to check your blood pressure at home. If you're one of those people that went to the doctor's office and you check your blood pressure and it was high just that one time, and the doctor wants to put you on blood pressure medication, I urge you to check your blood pressure yourself at home for 2 weeks and then show the numbers to your doctor next time you see him. So the normal blood pressure is less than 120/80. So if your blood pressure is 119/79, for instance, then that's normal number. Another important test that I want you to pay extra attention to is your liver enzymes test, which is under ALT and AST. So for optimal health, your goal for both of these tests should be less than 20. If you're one of those people that have high blood sugar numbers in the morning or dawn phenomenon, these numbers probably are elevated, and that means that you have fatty liver. We're gonna have a training regarding this as well. What you can do for fatty liver is very important because we want to make sure that your liver is healthy. Now, the high sensitivity C-reactive protein test, or as you see it on your test, under SHCRP, is a marker of inflammation. The normal is less than 1. As you can see, I didn't talk about kidney function tests because I want to have a whole training regarding kidney function tests. I hope you found the information I shared with you today useful and helpful. Make sure you check your lab regularly and you're on top of your numbers because these are very, very important. Let me know if you have any questions. Reach out to me. I would love to hear your story and meet you. Make sure you subscribe so you don't miss any future videos. See you next week.